Hello everybody and welcome to the Tuesday edition of Video Clips, and as usual I have some announcements. First of all, if you live within driving distance of Columbus, Ohio, you should be here on April 29th. It's a Saturday for our annual Women's Health Symposium. So we're going to talk about women's health from literally when you are a little girl all the way up through menopause and all the related issues, hormones to hot flashes. That's probably what we should have called it. A great name for it. But anyway, we have a guest instructor, Mary Marshall, who is a registered nurse from the northeastern part of Ohio, who will be with us. The food will be great, of course, because Chef Del will prepare an amazing lunch, which is included in the cost of the symposium. So plan to join us if you're in any place reasonable driving distance of Columbus. Another thing that I'll mention coming soon. Last weekend, some of us had the opportunity to participate in a 4-day program with Dr. Peter Bregan. And I will tell you, I don't think any of us who are in that room for 4 days will ever be the same. It was Peter Bregan unleashed. I don't know how else to describe it. Actual discussions about real people and some of their psychological issues. Anyway, it was all captured on film. And so we will be very soon launching a video platform that people can subscribe to that is for both consumers and therapists to understand better the devastating effects of psychiatric drugs and ADHD drugs and also the much better alternatives and how to handle these very real issues. So that's coming soon, but I'll tell you what's coming sooner is summer semester. And it actually is going to start in May because our statistics course is the longest course that we offer, 2 semesters of statistics, but we're going to go from May all the way through the end of the year. So that's one thing. And then the diet and lifestyle course, which we offer 3 times per year, which is a training program for professionals and lay people. Lay people take it too. We only have the celebrity instructors once a year in the summertime. So if you want to learn from Dr. Esselstyn, Dr. Barnard, Dr. Ralph Moss, Dr. Goldhammer, and some of the amazing people we bring in that are celebs in this industry, summertime is your chance. And as usual, we have a package of certification courses that you can purchase in addition to the diet and lifestyle course. So if you've been watching this for a while and you've been thinking about maybe if you're a health professional, you'd like to learn to do things differently, or you're not a health professional and you'd like to become one, this is the time you should definitely send me an email at pampopper@msn.com and let's have a chat about it. Let's just look at what your objectives are and how we can help you. All right, so a couple topics I want to cover today. A few weeks ago, I presented some research about the sodium and cardiovascular disease. This issue is very much like vitamin D. It just keeps coming up and coming up and coming up, and almost every day we have a discussion about it with somebody. So that's why I will keep covering it and covering it and covering it. It's sort of like omega-3 fatty acids. A few years ago, we spent all our time debunking the omega-3 deficiency myth, because that's what it is, and now we're on to vitamin D and sodium, seem to be the myths of the day that we talk about all the time. So right after I did that article, wrote that article and filmed the video clip about it, some more information became available, which I want to share with you, very much related to it. So, just starting from the beginning, there's a growing body of evidence that says that salt is not the cause of most cardiovascular disease, and salt restriction isn't needed for most people to prevent heart attacks and strokes. Another thing is people who adopt a low-fat, wellness-form, health-style diet, their sodium intake goes down and further restriction is really not necessary. Another thing about our diet is it's high in potassium because a lot of plant foods are high in potassium. More and more research is showing that this potassium issue is something that we should be paying attention to. We should be increasing potassium while we decrease sodium naturally by adopting the right diet. So, in a recent article, researchers wrote that hypertension is higher in westernized countries in which people consume a lot of high sodium processed foods, while people living in other areas of the world who eat a diet higher in potassium have lower blood pressure. The researchers state that studies show that taking potassium supplements lowers blood pressure and that higher potassium intake is associated with better outcomes regardless of the level of sodium intake. Now, I'm simply not proposing that people continue to consume salt like banshees and take potassium pills as, to compensate for it. That's not what I'm saying. I'm pointing out the fact that things get better even just taking potassium supplements regardless of how much sodium people consume. Other studies have shown that potassium supplementation reduces the need for antihypertensive medications, particularly in salt-sensitive individuals, since potassium increases urinary excretion of sodium. A study of adolescents found that increased potassium was associated with lower systolic and diastolic blood pressure, even when sodium intake was 3,500 milligrams a day or more. Now keep in mind, the American Heart Association, the World Health Organization, these are organizations that are pushing salt intake, trying to get people to restrict to 1,500 milligrams a day. And as it turns out, it does not seem to be necessary for most people. An analysis of 19 clinical trials showed that taking potassium supplements significantly lowered both systolic and diastolic blood pressure in patients with essential hypertension. The researchers concluded, and this is a quote, "An increase in potassium intake should be included in the recommendations for a non-pharmacological approach to the control of blood pressure in uncomplicated hypertension." Now, this I found very interesting. The DASH diet, the dietary approaches to stop hypertension, which is often cited as evidence that salt restriction is necessary and works. And I've talked about this before. The DASH diet involved a whole lot more things than just salt restriction. But it showed that increased potassium and calcium intake was associated with a significantly lower blood pressure in patients consuming a low, medium, or high salt diet as compared to controls. Now, there are several mechanisms through which the interaction of potassium and sodium influence the development of hypertension. One is that a diet that is high in sodium and low in potassium causes contraction of the smooth muscle in the blood vessel, which then results in an increase in vascular resistance and higher blood pressure. Potassium affects nerve and muscle function, electrolyte regulation and water balance, and with sodium, increases vasodilation and blood flow. When the balance of potassium and sodium changes, hypertension is just one of many negative consequences, which can include fatigue, constipation, many other adverse health events too. Most people don't consume enough potassium, and the reason is, where do we find the potassium? We find it in plant foods like tomatoes, broccoli, beets, green beans, potatoes, lentils, bananas, apricots, and cantaloupe. The Institute of Medicine recommends 4,700 milligrams per day. The average American consumes about 2,640. Why? Because they're eating a lot of processed foods and animal foods, not so much on the beans, apricots, and cantaloupe. Bottom line is that if you adopt a health-promoting diet like the one we recommend at Wellness Farm Health, it naturally lowers sodium intake, increases potassium intake, and lowers blood pressure for most people without further sodium restriction. And one of the problems that we have, and it happens in the plant-based community, it happens in all branches of medicine, is people taking recommendations and strategies that are really appropriate for a segment of the population and trying to use those same recommendations for everybody. There are some people who should not consume salt. That doesn't mean everybody needs to restrict salt in the diet to that extent. Just like there are some people who should never have any alcohol, and people who are allergic to peanuts should never have any peanuts, but it's when we try to expand those restrictions to everybody that we get in trouble. And then on to the next thing. This is just for fun, actually fun and constructive at the same time. A unique way to get people to eat more vegetables. Just put them on the table in meeting rooms and other public places. So here's the story. Researchers in the Netherlands conducted an experiment to see if they could get the Dutch population to eat more vegetables. Now, the Dutch government recommends a daily amount of only 250 grams a day of vegetables, which is just a little over 3 servings. And the Dutch eat just about half that amount. So 1.5 servings a day, not good, of vegetables. Now, we all know that just telling people to eat vegetables usually doesn't make much of a difference because everybody knows you should eat your vegetables. My gosh, the craziest diet recommendations in the world tell you or include recommendations to eat vegetables, but people just don't do it. So the researchers started putting vegetables in the lunchroom of a work site to encourage people to eat more. Well, that didn't work because people were coming in already with their lunches chosen, and they didn't want to eat something else instead of or in addition to, so the vegetables were untouched. But providing vegetables at business meetings and in hospitals at non-meal times, now that actually worked. So the researchers tried two ways of doing it, both in porcelain bowls and in individual little boxes. Well, when the vegetables were placed in porcelain bowls, average intake during a business meeting was 80 grams. In other words, people were consuming like 30%, a third of what they needed at just a business meeting. When each person was given a personal box of vegetables, consumption went up even more to 97 grams per sitting. Interestingly enough, when the researchers put some cookies on the table, people didn't eat less vegetables as a result. So apparently, people are interested in eating more vegetables. They're just not interested in going out to buy them, to eat them. It's encouraging, and I guess we have to take this little bit of good news with some mitigating factors and to make sure we consider those, which include that the vegetables were free. No initiative was required. Nobody had to decide, hey, I'm going to improve my diet and I'm going to go and get vegetables and eat those today. But still, it does show that availability and convenience, and probably somewhat the group dynamics, since this was done in a group setting, other people are eating the vegetables, I might as well eat mine, definitely have a positive effect. So vegetables can be really inexpensive if you buy them when they're on sale, which they always are. I know this Kroger store that's really close to us, just like a half a mile away. They always have stuff that's really marked down. That's what everybody around here lives on when we're not eating out of the Wellness Farm Health Kitchen. And at farmers markets, even less expensive. And so here's what I'm saying, or here's what I'm getting at. Most companies spend quite a bit of money on coffee and tea and beverages and snacks and cookies and things that you have out for meetings and you just provide in your employee break room and that sort of thing. So if you even took just a little bit of that money and you started spending it on fruit and vegetables and putting those things out, like the next time you have a meeting that might require serving something. I know that brownies might be more attractive to visiting guests, but maybe carrots and mushrooms and sliced bell peppers and some of those things would be attractive if you serve them too. And when employers do this, it sends a really strong message to employees. It says, hey, we would encourage you to eat better foods. In fact, our company strongly encourages, and that's part of our value system. We want people to eat healthy foods. It shows that companies care about their employees to serve better things instead of junk. So everybody wins in the end. So anyway, I thought that was a great story. I know around here we always have healthy food because we are Wellness Farm Health, so we don't serve the junk stuff, but everybody could do a little bit more of that. All right, that's all for today. As usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you on Thursday with more news.